Next, let us see the relations of the shoulder joint. Before knowing the relation, let me orient you to this picture. This is the sagittal section of the shoulder joint. This is the superior part, this is posterior part, this is inferior part, and this is anterior part. So the superior part of the shoulder joint is contributed by certain muscles and bones, and then bursa. So muscles, this is deltoid, this is deltoid, and then subacromion bursa. This is the acromion process of scapula. So below that is called subacromion bursa, and then acromion process, and then supraspinatus muscle, and then coracoacromion arch. So the coracoacromion arch, we already said it is formed by the acromion process, coracoid process, and coracoacromion ligament. So these three contributes to the coracoacromion arch. Next, let us see the posterior relation, that is infraspinatus bursae. This is infraspinatus muscle. So below that is infraspinatus bursae. This is acromion process. Below that it was subacromion bursae. Now this is infraspinatus muscle, and below that it is infraspinatus bursae, infraspinatus bursae. And then this is posterior part of the deltoid muscle. This is a huge muscle, posterior part of the deltoid muscle. It is called deltoid posterior fibers. And then this is teres minor. Next, let us see the inferior relations. It is contributed by posterior circumflex humeral vessels, that is this one, and then long head of triceps, that is this one, and then axillary nerve, that is this one. Next, let us see the anterior relation. So the anterior relation, as we already said, the posterior, the deltoid, it extends from the posterior part to the anterior part. It is such a large muscle. So anterior part also has deltoid, but it is called anterior fibers. And then coracobrachialis, this is the coracobrachialis. And then there is short head of biceps. This is the short head of biceps. This long thing is coracobrachialis, and this is short head of biceps. And then this is subscapular bursae. Now this you call it as subscapularis. So below that it is subscapular bursae. And then pectoralis major. This is pectoralis major. These all are together contributes to the anterior relations of the shoulder joint. Now let us see towards the middle of the shoulder joint. We already know that this is glenoid cavity of scapula, and then it has long head of biceps. This is subscapularis, so this is subscapular bursae. It is present below the subscapularis, so it is called subscapularis bursae. And then capsular ligament, this green color. Now here, this is axillary artery, this is axillary vein, and then this is capsular ligament, and then this is teres major. Now let us see the relations of the shoulder joint again. Superiorly, it has coracoacromion arch, subacromion bursae, supraspinatus, and deltoid. Anteriorly, it has subscapularis, deltoid, coracobrachialis, short head of biceps brachii. Inferiorly, long head of triceps brachii, axillary nerve, posterior circumflex humeral artery. Posteriorly, it has infraspinatus, teres minor, deltoid, and within the joint it has tendon of long head of biceps brachii. Now let us see the movements of the shoulder joint. We already said that the shoulder joint moves in polyaxial fashion. That is, it permits several types of movement. There are 6 types of movements, that is flexion, extension, abduction, adduction, medial rotation, and lateral rotation. So flexion is majorly contributed by pectoralis major and deltoid. Extension is majorly contributed by deltoid and latissimus dorsi. Adduction is majorly contributed by pectoralis major and latissimus dorsi. Abduction is majorly contributed by deltoid and supraspinatus. Medial rotation is by subscapularis, and lateral rotation is by deltoid. The accessory muscles are the main muscles only contributes to the main movement, and the accessory muscles just acts as an helping muscle. Now let us next see about the blood supply. The blood supply is by anterior circumflex humeral artery, and then posterior circumflex humeral artery, suprascapular vessels and subscapular vessels. Next, let us see about the nerve supply. Nerve supply is mainly by axillary nerve, musculocutaneous nerve, suprascapular nerve, Bursae. So there are three bursaes. We already saw it in the relations. Those are subscapular bursae, subacromion bursae, and infraspinatus bursae. Next, coming up to the final part of the video, that is the clinical correlation. So the shoulder joint dislocation is the first clinical correlation that we are going to see about. It is like most common type of shoulder joint problems that ever one could encounter. It is most common because we already saw that the glenoid cavity is very small and the head of humerus is 4 times larger than the glenoid cavity, and inferiorly it is like very least supported, so the shoulder joint dislocation could be most easily or commonly through the inferior part. And next one is the frozen shoulder. So next one is the frozen shoulder. It is also called as adhesive capsulitis due to the shrinkage of capsular ligament. So we already said that the capsular ligament lines the glenoid cavity. So once if the capsular ligament shrinks, it leads to the adhesive capsulitis. So once again, this is the capsular ligament, this green color thing. If it shrinks, it shrinks up to the level that it tightens the whole shoulder joint, leading to the frozen shoulder or severe pain when the person tries to lift up his hands or something. So this is called adhesive capsulitis. Next is the axillary nerve injury. So we already know that the shoulder joint is least supported inferiorly, and once if there is shoulder joint dislocation inferiorly, it also has high risk of damaging the axillary nerve. So the last one is rotator cuff disorders. So we already said rotator cuff muscles are four, that is supraspinatus, infraspinatus, teres minor, and subscapularis. So these four muscles are like it provides so much stability to the shoulder joint. These muscles are like injured when there is repetitive use of the shoulder joint above the horizontal level, that is in case of swimming, throwing, etc. This is the most common cause of shoulder pain. So with this I end the video. Hope it helps, and once if you find it helpful, please consider subscribing to my channel for more such videos. Thank you so much.